Hi everyone, welcome to our video on dental hygiene in collaboration with PSWs. Here's a picture of our group so you guys can identify us easier when we have our in-person meeting. Dental hygienists are essential in improving oral health. We identify oral diseases, educate clients on proper brushing and techniques, and provide cleanings. We stress the importance of good oral health for overall well-being. Mouth care is vital, especially for residents who depend on caregivers for oral hygiene due to cognitive or physical limitations. Good oral habits prevent issues like cavities, or can lead to loss, pain, and negatively and impact on quality of life. The oral systemic link connects oral health to conditions like cardiovascular disease, pneumonia, and diabetes. Mouth inflammation can affect blood sugar and increase the risk of lung infections. Good at-home care can reduce systemic inflammation, leading to better overall health.
Plaque is a sticky layer of bacteria that forms on the teeth and dentures. That fuzzy coating on the teeth upon waking up is plaque. It forms consistently throughout the day. Plaque cannot be rinsed away with water or mouthwash. It must be physically scrubbed off using a toothbrush or denture brush. Plaque builds up most heavily in 4 locations: along the gum line between the teeth, in the deep grooves of the back teeth, and on the inside of a denture, the part that sits against the gums. Fresh plaque is clear or pale yellow, making it difficult to see. As plaque thickens, it becomes visible as white, yellow, or grayish layer along the gum line or on denture surfaces. If plaque is not removed daily, it hardens into a crusty deposit called tartar or calculus. Once plaque hardens, a toothbrush cannot remove it. Only a dental hygienist or a dentist can scrape it off. Daily brushing and flossing is essential. Rinsing is not efficient enough to remove plaque.
Gingivitis is the earliest stage of gum disease and happens when plaque builds up along the gum line. The gums become red, swollen, and bleed easily when brushing or flossing. At this stage, the inflammation is completely reversible with good oral hygiene and professional cleaning. When viewing the image, you can point out the puffiness and the bleeding points along the margins. If gingivitis is not managed, it can progress into periodontal disease. This is a more advanced condition where the inflammation affects the deeper supporting structures of the teeth, including the periodontal ligaments and the bone. Patients may notice persistent bleeding, bad breath, dry mouth, gum recession, and even loose teeth. Unlike gingivitis, periodontal disease cannot be reversed, but it can be controlled with treatment. When reviewing the image, you can notice the receding gums and calculus deposits, also known as bacteria buildup, that hardens over time when not cleaned. Dental caries occur when bacteria and plaque use sugars to produce acids that damage tooth enamel. Early signs appear as white spots on the teeth, while advanced decay can cause dark holes, sensitivity, and pain. Prevention includes brushing with fluoride toothpaste, flossing, limiting sugary foods and drinks, and regular dental checkups. Denture stomatitis is inflammation of the tissue under a denture, often caused by poor denture hygiene or wearing dentures continuously, especially overnight. It appears as redness and irritation of the palate and is commonly associated with candida overgrowth. Prevention includes removing dentures at night, cleaning them daily, soaking them properly, and ensuring a good fit. When reviewing the image, you can notice that there is an evenly red inflamed palate beneath the denture. When you look at the first image, you can see the white patches on the tissues. These wipe off easily and leave a red sore surface underneath. This happens because candida and fungal organisms overgrows, especially in smokers, denture wearers, or people with weakened immune systems. In the second image, you can see the swelling and the small area of pus near the tooth. That buildup of bacteria causes pain, pressure, and sometimes a bad taste. An abscess always needs immediate dental treatment because the infection won't go away on its own. For the third row of 2 images, You can see the dry cracks and redness at the corners of the mouth. This often happens when saliva pools in the corners, or when there's a fungal infection or a nutritional deficiency, such as low iron. Treatment depends on the cause, especially by identifying the source is the key to healing. Fluoride plays a major role in keeping teeth healthy. It strengthens and remineralizes the enamel, and it can even slow down or reverse early stages of tooth decay before a cavity forms. By protecting the enamel, fluoride reduces the risk of dental caries and lowers the need for future restorative treatments. From a patient care perspective, fluoride helps preserve natural teeth and supports the preventative side of dentistry. It improves long-term oral health outcomes and overall quality of life, especially for patients who are at a higher risk for cavities. To make sure patients receive enough fluoride, they should be brushing twice a day with fluoride toothpaste. Some patients may benefit from a fluoride mouth rinse if it's recommended by their dental professional, and during dental visits, professional fluoride treatments such as varnish or gel will be provided as an extra layer of protection.
Foods and drinks have a direct impact on oral health. Plaque feeds on sugar. When a patient eats or drinks something sweet like juice, pudding, crackers, or thickened liquids, the plaque eats the sugar and produces acid. That acid eats into the hard outer layer of the tooth called enamel. Over time, repeated acid attacks create a hole called a cavity. Once a cavity forms, it does not heal on its own. A dentist has to fill it. Several factors place older adults or dependent individuals at higher risk for cavities. Many older adults eat soft foods high in hidden sugars such as pureed fruits, puddings, soft crackers, and thickened juices. These foods stick to teeth and dentures, giving plaque a consistent food source. Many medications cause dry mouth. Saliva normally washes away sugar and neutralizes acid. Without saliva, sugar and acid remain on the teeth much longer, increasing cavity risk. Sugar also feeds funguses on dentures, which lead to red, sore gums under the denture. Practical strategies can reduce these risks, such as offering water after every meal or snack, rinses away sugar and acid. Each sweet exposure triggers acid attacks for up to 20 to 30 minutes. So frequent snacking means prolonging acid exposure. Sugary drinks should never be placed in a night bottle for confused patients. Juice, sweetened, thickened liquids, and milk will pool in the mouth all night, continuously feeding plaque. So in summary, sugar feeds plaque, plaque produces acid, and acid causes cavity. Water helps wash away all the sugar and acid.
There are several government-funded programs in Canada to help those facing financial barriers to dental care. Healthy Smiles, Ontario offers free preventative and treatment services for eligible children and youth. The Canadian Dental Care Plan provides coverage for eligible Canadians without private dental insurance.
For more detailed instructions on patient positioning for oral care, please click the link above. During our visit, we'll demonstrate several oral care techniques, including how to complete an oral scan, provide bedside oral care, and properly clean dentures. After the demonstration, you'll have the opportunity to practice these skills with the mannequins and while we provide feedback and guidance.